and veterinary staff. And before we move ahead with Dr. Sue's presentation for the night, we have a very special presentation and update from Dr. Krista Arsenault, who I'll be introducing to the group today. And so Dr. Krista Arsenault is a veterinarian that wears many hats. She is a lead veterinarian for the Ontario Ministry of Agriculture, Food and Rural Affairs, which is OMAFRA. She has provided leadership on biosecurity, emergency management, and preparedness, and is a leader of the Ontario Animal Health Swine Network, also known as OWN. She has been involved in working on African swine fever preparedness over the past several years and has been the national ASF manager with Animal Health Canada and also held the position of OMAFRA's ASF manager. Krista is also the national manager of the Canadian Swine Health Intelligence Network, also known as CSIN, for swine disease surveillance. She's been involved in the swine industry since before graduating from the Ontario Veterinary College in 2006. She's also worked in private practice as well as the Canadian Food Inspection Agency. So welcome, Krista. We're excited to have you provide your presentation today.
Well, thanks so much, Doris, for that introduction, and for to Sue and Doris and team at Animal Health Canada for allowing me a little bit of time today to come and speak to you about what I think is a pretty neat kind of groundbreaking initiative that we have ongoing for surveillance right now in the swine industry. So today I'm going to talk to you about a program, surveillance program that's been launched called CanSpot ASF, and I'll walk you through what it is and give you a little bit of an overview on African swine fever while I do it as well. All right, so I just want to review a little bit of the details surrounding around why African swine fever, a foreign animal disease, has kind of caught the headlines over the past, I guess it's 3.5 years now, and why there's so much preparedness and planning happening in advance of a foreign animal disease being detected in North America and hopefully never in Canada. This is a foreign animal disease that since 2019 has been spreading really rapidly throughout the world. The cause of this rapid spread to date is truly unknown, and it's case by case in speculation on how it has arrived and spread to many different countries throughout Europe, Asia, and even in the Americas. So I guess the latest, scariest detection perhaps for us, just simply based on proximity, is it was detected in the Americas a couple years ago now. So the Dominican Republic specifically. And neighboring countries. So it's here. It's in the Americas. It's just not in North America. And we have a lot of people that travel back and forth between the Caribbean countries, especially this time of year. And so I guess the biggest risk of this virus being transmitted or spread into the Americas, US and Canada, would be through human traveler importing illegal but pork products from the Caribbean. Most of the time that happens unknowingly. Sometimes it is intentional, but the majority of the time that's happening unknowingly by travelers. This is a virus that if it's ever detected in Canada, the US, what we would see is all international trades and borders would close immediately. As soon as the detection was announced, that's what we would see. And this would lead to never before seen unprecedented market interruption challenges. The Canadian pork industry relies on approximately 70% of the pork that we produce to be exported internationally. And a majority of that portion is exported into the States. And so no matter where this virus hits, it is going to be absolutely devastating if it arrives in the US or Canada. So I just have this little diagram here. It just kind of indicates kind of what we would see post-detection. So the international borders would close. We'd see almost an instantaneous loss of markets. Farm gate prices would absolutely collapse. And then we would immediately see a surplus of healthy animals. So these wouldn't be pigs that are infected with the virus. Most of the animals that would be affected would be, unfortunately, on the wrong side of the border closure. And so they'd be pigs with no home and no home to go to. And then we would have to, unfortunately, deal with depopulating of those healthy animals simply because there is no home and there's nowhere for those animals to go to, and there's no market for the pork at which they would produce. So I think everyone on this call will know this as veterinarians, but I really want to emphasize that as veterinarians, we have a really important role to play in animal health surveillance. You, as veterinarians, are the first people with your boots on the ground when animals are deemed to be unhealthy or your clients need veterinarian advice. And all veterinarians have the ability to submit samples to veterinary laboratories all throughout Canada for testing and confirmation of disease. So, with that important role, we play a very important role in early disease detection, especially of a foreign animal disease if it were set to arrive here in Canada. So, I wanted to remind everyone of some of the clinical signs. Some of you, this wouldn't be too long since you've graduated from vet school. Others, you may have been a little bit longer, like myself. Since you were reminded of the clinical signs of African swine fever. It presents with a vast array, potentially of clinical signs, but what you can see is pigs with diarrhea, pigs that are vomiting, reddening of the skin, particularly around the ears, the snout, is pretty common with this virus. Weakness, unwillingness to stand, labored breathing, coughing, some reports of bloody nasal discharge. So again, that's due to the internal hemorrhages that ensue due to the virus. And then it can cause abortions, stillbirths, and weak litters. So, for anyone on this meeting today that have seen pig clients, and especially to any extent, you'll see these clinical signs and say these could be associated with a lot of other things, pathogens that we have present in swine currently. And Sue will be reviewing things that match this list. And that's exactly the issue that we have with early detection of this virus is often it presents a little bit milder in clinical signs in some of these countries, and so it's not right in your face that you know something's wrong. It could be assumed to be many other pathogens that we see normally in swine in Canada. All right, I want to talk now about CanSpot ASF. So I have included the logo on the top of the slide. Just if you see it floating around, now you can associate with what it means. What is CanSpot ASF? So it is a risk-based early detection surveillance program that has been launched at approved laboratories. So these are laboratories as part of the Canadian Animal Health Surveillance Network, the CASN network group in Canada. And its real purpose is to detect African swine fever early, and especially if it's being masked with clinical signs of other diseases that we already have here in Canada. And so, any herd, any owner of a pig with a history of any of the disease conditions that meet eligibility criteria, and I'll go over that on a subsequent slide here, any veterinarian can submit samples and flag on the lab submission form. I'd like to include this in the CanSpot ASF testing program. What we do need, if you are going to submit samples underneath of CanSpot ASF, and we'd encourage all of you to do that, is the appropriate tissues. And so I have listed them on this slide here. The main one, if you just want to remember, is take a portion of the spleen and submit it. If we have spleen, we can always run the ASF test as long as we have enough spleen. And so if you have a pig that dies and you don't know why, just add a little portion of tissue of spleen, submit some samples to the lab, and then please include in CanSpot ASF. The rest of the triage can be done at the lab specifically. So, the decision of whether or not a case is eligible can be made at the veterinarian level. But it can also be made at the pathologist level. And so, if you're just not sure if whether or not a sample would meet eligibility criteria, that's completely fine. Just flag that on your report, your submission form, and let the pathologist deal with it that have also been trained in this early surveillance program. There's zero cost to participate, and so all of the CanSpot ASF testing is completed underneath of the provincial or territorial government budgets at current, and that varies a little bit from province to province. But the main message is there's no cost to the producer, to the submitting veterinarian to submit samples. We are also or this program has also been launched in abattoirs. So both at federally and provincially licensed and inspected abattoirs. So we are seeing samples from pigs that are condemned due to eligible reasons underneath of the CanSpot umbrella. and inspectors at plants are sending in those samples as well, and they're being tested for CanSpot ASF too. So this is the list of eligibility criteria that is listed underneath of the CanSpot ASF program. Basically, I heard this from a pathologist that I work closely with. You can make pretty much anything fit underneath of the CanSpot ASF program. There's very few exceptions of things that can't fit. And so when in doubt, I just would encourage you to feel free to reference this list, but have an open conversation with your laboratory pathologist on whether or not it would fit, or just include a tag on the end of your submission form and they can figure it out. All right, so you might be sitting back and thinking, well, what happens if a test that I submit comes back as suspicious or positive underneath of the CanSpot ASF program? What happens from there? And so this is detailed quite thoroughly underneath of the CanSpot ASF program, but the laboratory involved will immediately inform that submitting veterinarian, as well as their local district CFIA office, where that pig was located. It is important, and I missed this on the previous slide, that we do need information on a premise identification or an address, something that tells us exactly where the pigs were located on your lab submission form as part of being eligible. Just makes sense. If we need to do quick tracebacks to figure out where that sample came from, we need that information right at the ready. What then would happen is the CFI district office involved will check the health of those animals on that premise. And together with the private practicing veterinarian on the case, they should be working collectively to collect some samples from additional pigs on the premise, coordinate that collection and shipment of the samples, and they will be going out at that period of time to the National Center for Foreign Animal Disease, known as the NCFAD lab in Winnipeg, which is CFIA's main lab. And that's where they will complete the confirmation of whether or not the sample is truly ASF positive or not. The one thing I would just like to identify is the ASF test we're using is an excellent test. There is very little probability in false positives or false negatives. And so if we do get a suspicious test back, the odds are high it is it is positive, that it will not be a false positive. And so that's important, I think. It gives veterinarians the confidence in the test, and it gives me the confidence to know that the program is in place for that early detection cause. The CFIA will then determine a risk on that premise based on what they see and based on what their epidemiological survey reveals of whether or not they think that that premise is a high risk or considered not a high risk underneath of their terminology. And they will put movement restrictions on that premise depending on their risk level that they're assigning to the case. And it kind of depends on how far away you are from NCFAD, how quick those samples will be tested, and what the CFI would be seeing on a case by case basis on how long that period would be until confirmation of disease. If ASF is confirmed at the Winnipeg lab, then CFIA will, of course, maintain or enhance their movement restrictions that they initially put on the premise when they take additional samples for testing and initiate their response activities. So CanSpot ASF every quarter has a reporting system that comes through the Canadian Swine Health Intelligence Network, CSHIN, the network that I'm the manager of. And so we have regional or provincial surveillance network leads. So we have Western Canada, the Maritimes, Quebec, and Ontario that participate in our national surveillance network for swine. And so they report their numbers on what samples are tested where. So the top graph represents abattoirs. So you'll see there's different numbers that are tested in different regions all across Canada every quarter at federal abattoirs, and then provincial abattoirs as well. I think it's important to note that the majority of pigs are sent through federally licensed abattoirs, not provincial abattoirs in Canada. And so that's why the discrepancy in the numbers there are heavily weighted on federal abattoirs. And then we report, of course, on the total number of negative cases because we have not obviously had any positive cases, and we hope that continues every quarter. The bottom table indicates the samples that are tested at the lab. So these would be samples you send in as a veterinarian, or your clinic would send in to the lab, and or the pathologist selects to be tested underneath of the CanSpot ASF program. So again, reported zero positive cases, only negative so far. So we report these tables out quarterly in the veterinary CSHN reports that I publish and communicate via the CSHN listserv. So if this is something that's of interest to you, I've put my contact information there in the bottom corner. Please feel free to email me, and I can get you added to the listserv to get those swine-specific surveillance reports quarterly. And again, there's my email address and how to contact me with regards to today's presentation. And I'll leave it open for Sue or Doris to add anything that I may have forgotten. Thanks.
Thanks, Krista. I guess one thing is what you mentioned before as well in another call, may explain routine. So I always remember that phrase.
It's
Just wanted
catchy.
to, yeah, it's very catchy. Just wanted to open it up with to the group. Any questions or comments for Krista? All right, thanks, Krista. And I'll make sure if there are any questions that I'll flag it and follow up with you if there is a question after the presentation after Sue's. But thanks so much again for the update. That was great.
Thanks so much for the invite, and thanks for taking the time to everyone on this call to attend this. Love this course that Sue and Doris have put together here. It's great. So thanks, ladies.
Thanks,
Thank you,
Krista.
Krista.
Bye.
Bye. All right, Sue, if you want to go ahead and share your slides, we should be.
Yep, I think we're ready here to go.
That looks
Okay,
great.
okay, let me get this up. Okay. So I just want to thank Krista again. I think, a lot of times we sort of dust these things to the back of our minds, as far as foreign animal diseases, and the constant reminders keep us refreshed and also very much aware of the potential impacts. So the faster we detect something like this, the faster we can contain it and hopefully deal with it and get our world going again, because the fallout, certainly in my world, and we saw this with foot and mouth disease in Great Britain years back, was not only do you have producers losing their livelihood and all the food chains are disrupted, but somewhat selfishly, I guess, in a smaller way, veterinary clinics were dreadfully impacted as well. And a lot of people lost their livelihoods, including veterinarians. So it's really important to keep these things in the back of your mind and be aware. So on that sort of serious note, we're going to go into some pig procedures today. So last week we discussed, the sick pig and postmortems and all those really exciting things. And now we're going to, drill down a little bit more and, get into some more specifics. So, sort of things to think about when you've got your little kit bag. What am I going to bring with me to smallholder operations? What's kind of useful? I, quite frankly, don't carry a lot because I deal with large commercial farms, and we ship everything out, or I'll deliver as needed. You dealing with smallholders, it's a lot more unexpected. So you want to have sort of a grab bag of items in your kit, some different antibiotics, some sedatives, because if it's something to do with, a minor surgical procedure or maybe even foot trimming, just to remind you, and I'll have another slide on this further on, but you want to really ensure that if you're using something like butorphanol, only to be used in pigs that are not going to be used for food, because we don't have withdrawal time on that. And so, just keep that in mind. Analgesics, you'll need those for sure, and a variety of needles, syringes, surgical packs, maybe not. You can go cold surgery, cold sterilant is fine too. and gloves and things. So I think apparently I'm beating this topic to death because I think this is the third week I put this slide up here. So, you know, it's a reminder of pig restraint. Small pigs can be easily held. It's amazing how they can also beat you to death with their legs if you're not holding them properly, and the pig is big enough to kick the you know what out of you. Larger pigs, again, don't use the snare unless you really have to, because it is the screaming's intense. It's not that it's stressful on the pigs, surprisingly, and I should insert that. They just don't like being caught. So they'll back up because it's a natural response to being captured. And frequently in my world, you know, if I've caught a pig and, you know, bled it and let it go, when you're trying to catch the next pig for bleeding, the first pig who's been caught will often come up and try and get at the snare perversely. So it's not a painful thing. It's more of they're objecting to being restrained and not being able to move, just so you know. Again, boards are a really good idea. So you know, if you're getting into smallholder pig practice, you may or may not have these available on the farm. Never make assumptions that all the equipment you need is going to be there. So you can get a couple of pig boards, a rattle paddle, and you know, you'll have some equipment there that you know will work. Again, where to inject the pig. So you want to be sure intramuscular injections are always given into the neck. Subcutaneous, you know, underneath the elbow skin there. We never inject in the hind end of the pig, especially those for food production, because those are the high end cuts of the pig, and you don't really want to have anything, you know, accidentally introduced. You know, a small piece of skin gets in there and you have an abscess, and then, you know, you've got some really big trim demerits that are costly to these smallholders. So just be aware of that. And the skin is actually a lot softer and easier to penetrate up in the neck area than it is in the back of the pig. What size needles? This is a piece of information that's from Canadian Pork Excellence. And it depends on the size of the pig. So of course, the smaller the pig, the smaller the needle. It's a bit of a busy chart, so I've actually simplified on the next slide, but you have a variety of needles you can use. So obviously carry a variety of needles with you, but also, you know, have a look at what the producer is using for needles. Again, you don't want to have them reusing needles too many times. They may be thrifty, but that it's really not going to save them good money, because again, they're going to be the longer these needles are being used, the more the tips are going to bend, and then we're going to get into issues. So encourage them to have a selection of nice, sharp, unused needles that, you know, will be useful for them down the road. Very occasionally a needle might break, whether it's a manufacturing defect or just, you know, a twist of fate. And so many people, you know, will grab a pair of pliers, and you can often see the remnant of the needle sticking out, and you can pull them out. If the producer can't get the needle out, you know, and the skin closes over top, bit more of a problem. And in commercial swine, even though we use detectable needles, and you have to use them in smallholder operations as well, because there's a scanner that will pick them up at the plant. However, nobody wants them, and nobody's going to do, you know, the trimming down to make sure you've cut that needle out. So the recommendation for commercial herds is we usually just euthanize that pig, unfortunately. For smallholders, they can tag or mark the pig and alert the butcher if they're using this pig for their own consumption. And then let's say the needle was stuck on the side of the neck, and they can trim out that muscle if it's fairly soon after the needle gets stuck. And then the pig can, the rest of the pig can be used for their own consumption. But as I said, you know, use sharp needles, don't reuse needles, don't straighten out bent needles. I've known a couple people that have done that. You know, metal wears when it's bent. So no temptations to save money. This slide's a whole lot easier. Piglets get 20 gauge by ½ inch. Wieners, what's a wiener? 3 weeks old and up, still 20 gauge, ½ inch to 3/4 inch, depending if they're just weaned or they're 2 or 3 or 4 weeks older. Big wieners, well, we're talking, you know, 15, 20 kilos, grow finish. and you'll see the 3/4 inch and big weaners grow finish 1 inch, and that's because the muscles are thickening, and so is the fat layer over top. And sows, most people are probably using 16 gauge 1.5 inch. Younger gilts, you can use 18 gauge 1.5 inch, and again, never ever in the hind end. We have options for pig sedation. Oh boy, there's lots of good things here. I don't know if I have my favorite. I think my go-to certainly for commercial swine is a Zaparone, which is also misspelled at the bottom, and I could not sort that out because I think I cut and pasted that from my photograph. So at any rate, Stresnil, which is actually no longer available as Stresnil, but you can get a Zaparone formulated by pharmacies. Very, very, very useful product for low dose if there's some scrapping in these small holders and they want to just slow everybody down. Let's say you've bought some gilts and they brought in and they're not getting along. Some people, I don't see it used much anymore, but they might give them some Stresnil or a Zaparone to just calm them down so they can all start getting along. Sedation and then hard knockdown. There's the dosages there. I seldom go for hard knockdown unless I'm euthanizing a large sow or boar. Then I'm fine with that. It's relatively inexpensive and probably a really useful product to have on hand. It is a useful product to have on hand. The ditomidine, butorphanol, midazolam, that's pet pigs, potbelly pigs, and we'll get to that next week. You'll probably see this slide again. It's pretty expensive stuff. Xylazine and ketamine, meh. If you were to ask me what I think of it, I'm more of a meh with that combination. Haven't used diazepam and ketamine precisely because diazepam is not approved for food-producing animals, so it's off my list of fun things to use for smallholder swine that are used for food. Ace, promazine, and ketamine, again, I haven't really used that. I think you just sort of find what works for you and you go with it. And as I said, it's pretty much the Zaparone that I find is pretty useful for what I'm doing. Just because I want to keep you guys awake and interested, yes, you can also use beer. It's a wonderful sedative. Anybody that enjoys it will know what happens after a few beers, especially if you're drinking a Belgian double or triple. It will keep you in your chair for the rest of the evening. I actually had a Quadro once. I cannot believe I did this. We have local breweries here and got talked into trying one. And he said, you don't want to go out if you're going to be drinking this at home. And I went, okay, that's fair. And so one night I was sort of low in the fridge of beer and I thought I'd have the Quadro. And yes, I sat in the chair for the entire evening. It was delightful. So you can use beer on pigs. I have used them mainly in pet pigs to just calm them down. But I guess if you get stuck and you've forgotten your xylazine and you have no Stresnil on hand, you can use a beer. What kind? Well, that's your call. This was something I tripped across. I'd seen it a few years back. It's pretty old now, 2013, but a cool story about a feral pig that got into some backcountry campers area and literally crushed a case of beer, got loaded and woke the next bunch of campers up when it got into a tussle with a cow, and the two of them were pounding around the campsite. And they found the pig somewhat later sleeping in some tree roots, drinking off or sleeping off its hangover. So kind of funny. But that tells you that pigs can consume a lot of beer. We'll leave it at that. Pain management. So I referred to the meloxicams, ketoprofen. So I've circled the ones that have withdrawal times for meat producing animals. Meloxicams used mainly on piglets post castration. We use it. It's fairly short duration of activity. If you read the studies, I've seen 2 to 4 hours. So it's not certainly a long-term product. Ketoprofen has a better duration of activity at 12 to 24 hours. Flunixin or Banamine is pretty high in my go-to list, 24 to 36 hours duration of activity, according to one of the documents I was reading. Little longer withdrawal time, so be aware of that. And actually, as a matter of fact, back up to Zaparone used to be, I think now, I think it used to be 5 days, it's withdrawal, 3 or 5 days. Anyway, forget that. It's now 13 days, just so you know. I don't have it marked there, but it is a 13-day withdrawal. So again, butorphanol, buprenorphine, only for pet pigs. We're not going to use this for animals used for meat production. So let's get into a few procedures. There's a couple of links there. One is mini foot trimming. You'll see that next week again. Practical sow hoof trimming guide. There's an article there. Really, I haven't really done a lot other than what we call a slipper-footed animal, and I meant to put a photo in, but I couldn't find one in my collection. So sows with long curving hooves, you see them also in dairy cattle. They do need to be addressed because it causes issues with, lameness after a while. So if anybody's, really excited about being a hoof trimmer, you need some kind of goat hoof trimmers or horse hoof nippers, Dremel, and really, again, you only trim them as you have to, because you're going to have to sedate her and, have her steady somewhere as you're trying to do the foot trimming. So it's a little bit of an art. We don't trim the heel. If you really look at, I think I got a photo there. It is on the bottom, the back portion of the pig's foot. There's quite a large soft pad there that they use for absorbing some of the shock and also balancing. So don't ever touch the back part. You're only going to really be trimming the obviously the front part of the hoof and just the hoof wall. And go gently, because they start bleeding, you've gone too far. It really shouldn't be too big of a problem, but again, you just want to be careful, and be careful with that you mind the dew claws, and if you can trim them as well. But it's hard. These things are pretty take a firm hand to and a good muscle to do your hoof trimming. Castration, there's always someone that's going to call you to castrate their pig. I have this delightful couple in their 70s who call me about every year or two, and they have a litter every year or two. And the first year they called me, they asked me to castrate 5 boars in the litter, and have the presence of mind to ask them how big they are, because these little piggies were not little piggies. They were probably 80 or 90 pounds, 40 kilos. They kind of gotten away on them. So it was a bit of a rodeo, but we got them sedated and got them castrated and took care of the matter. And I said to them as we were settling the bill, I said, it gets a whole lot cheaper if they're a whole lot smaller, because it's a whole lot faster. And so the next year they got them down to about 20 kilos, and it was easier. And then this year, amazingly, they only had one little boy in the litter, which happens, and he was about a 10-kilo pig, and it was just right slick. So they actually got the message and called me, and it was just a whole lot easier. So it's a bit of a teachable moment, I guess, if you will, but boy, it sure saves you a lot of grief. Also because we were trying to get piglets out of a pen where there was a giant, 300-kilo sow who was really unhappy with the screaming that was going on. So you have to be mindful of what's in the neighborhood when you're trying to catch these guys. So we castrate to decrease boar taint in meat. And any piglet that's done after 10 days, we have to sedate them. And so that would be your Zaparone, and also give them pain control afterwards, and Metacam's appropriate. That's what's used on commercial farms. If you feel you want to use something like Banamine or, ketoprofen, perfectly fine. Most castrations on commercial farms are done on fairly young pigs, 2 to 3 days of age. The only issue with all of that is if there's a scrotal hernia, it's not easy to detect in these really young piglets. I have seen mechanical pig holders used, and again, that's probably more for the commercial farm, but I know it looks like a device of torture. It's not. The pig's head is facing the left and it's lying on its back, and this arm flips its legs, its hind legs forward, and the testicles are sitting right up there exposed, and the job can be done pretty quickly, and away they go. But it's probably not something we're going to see on smallholder operations. That's why you were being called out to take care of it for them. So, you may be called out more likely because there's an inguinal hernia. So there's a testicle and a bunch of intestines all lying together there, and you get to sort it out. So you'll find that sedation or anesthesia, they're both going to be required. It's not and or, it's yes, we will be. And local anesthesia is probably good. And I think especially in this era of pitifully poor pig prices, this procedure may be cost prohibitive. And so often these pigs are just grown up to, 30, 40 kilos, 50 kilos and sent out as barbecue pigs. And again, if the pig is a bit larger and not too large, because it's going to be impossible to do a scrotal hernia on a 40-kilo pig, for example, be careful of withdrawal times if they're going to go for the barbecue market. So I don't have any good photos. I'm sorry about this, because we just don't do these. They just go, like I said, to the barbecue market. If they're pet pigs, that's next week, and that'll be done in clinic. So it's a whole different thing again. So there's, basically make the incision and dissect the tissue and pull the tunic free of their scrotal attachment, and actually twist the tunic and the testes and force the intestines back along into the peritoneal cavity. And then you cut the tunic and the cord, and you close everything up with sutures and close the skin, etc. So you can see it's a bit of work. It's not hard. It's a bit of work. And again, it's the cost becomes the prohibitive factor here. What's easier? Tape the pig. Boy, did we just have fun tonight. Yep, skip the surgery part. This is where it gets economically feasible for the producer and you. So you may be called out just to do the castration. So you're going to push those intestines gently in and then make the cut, remove the testicle, and then really quickly tape and do a little X pattern around there. And so leave it for a couple days, and the incision should be nicely healed. And as the pig grows, you're going to say, well, what about that inguinal ring? It just gets smaller as the pig gets bigger, so we're all good. So hopefully it works. I see a lot of taped pigs in commercial swine. This is just a brilliant idea, and works quite nicely. And everybody's going to love you because you save them money. Adult pig castration. Again, definitely sedate those big puppies heavily, and you're working in the back end, and you've got to give them pain relief afterwards, because there's a lot of, the testicles are quite large, and seldom will you have to do mature bores, but you might, get these pigs like I had that were, 40, 50, 60 kilos, kind of got away in them. And so if you're going to be removing them, the only one thing I would tell you is to make your cuts somewhat lower on the testicle as you're removing them, only because you're going to need some drainage area for the fluids to leak downwards. If you cut too high, you're going to wind up with a pouch and a pile of fluid, and you may have to be called back to deal with that. So just remember to allow for drainage. The other side of that story is, here's a bore on straw. I don't need straw getting in there too badly, and let's just all hope that they call you much before we get to this point, and then life is a whole lot simpler. Cryptorchid castrations, I don't do these on farm. They used to be done years ago, years and years ago. We don't do them anymore. If you really wanted to with a smallholder, it's usually the left testicle. So make sure when you're going to do a cryptorchid, if you're adventurous, turn that pig around and look at the back of it, and just be absolutely sure it's the left side, because you get into it and it was like, is it the left or the right? Because you remove the retained testicle first, because that way you're not going to get lost trying to remember if it was the left or the right. So take out your retained testicle, you just do a lidocaine block, make your incision, and start fishing. and then you'll pull out the testicle, and then you can remove the other side and sew it up. And again, pain relief is a must with this, because they're gonna be sore afterwards. You were cutting through all these muscles. This is just basically taking it through the surgical procedure. It's not hard to do. I often, with anything that's invasive like this, I'll use a long-acting antibiotic afterwards. If you're doing boar castration, for sure, again, because it's just the size of the opening that you've got there that you're doing the surgery through. It's just an invitation for bacteria to have a party. So make sure that you use some antibiotics afterwards. But again, a lot of cryptorchids just go to the barbecue market, because you're not going to get boar taint for a long time, probably 5 months before you really are into the zone of maybe this guy's going to have boar taint. So if they're 3-4 months old and of the size that the local butcher wants, or you can sell it as a barbecue, then I would suggest you probably do that. You're not going to get into boar taint territory at that size. Umbilical hernia repair, probably not. And I actually, well, I should say probably not. If it's a small pig, maybe you'll have a successful surgery, but most hernias actually probably start out as abscesses. And, certainly because it's an umbilical remnant abscess, the wall of the abdomen doesn't, seal properly. And so you've got this little nidus of infection there. It could be umbilical cord contamination. I can't speak tonight. Possibly a polygenic inheritance. So first of all, how do we prevent it? Spray iodine on fresh umbilical cords, trim them to about 10 centimeters. Don't cut them too short. Just trim them back about 10 centimeters. You can spray iodine. That's always worked for me, or it's helped anyway. But most hernias actually tend to be abscesses, polycystic abscesses that just kind of keep going and going, like the Duracell bunny. They can get really big, to the size of basketballs, or they can be a combination of a true hernia where there's actually intestines getting in and abscess. I had a case on this a while back as an expert witness, and learned from a really interesting Danish study in a abattoir, where they actually took the trouble to cut all these hernias open. And I think only about 17% were true hernias. The rest actually were polycystic abscesses. So there you go. If you're going to be brave enough to do it on farm, it better not be too big, because you're making a fairly good size incision. If it's a male pig, well, now you've got to reflect the prepuce and off to the side, and then you can do the rest of the operation. And you be mindful that they're usually abscess, which I'm going to tell you, probably not a great idea to be doing an umbilical hernia, because you may get into some doo-doo if it's actually polycystic abscess. So again, it gets down to economics, and a lot of times it's just we'll grow it up. It doesn't hurt the pig. I mean, they can grow up to a certain point, but these hernias can enlarge, and you certainly can't ship them after a certain point. They can't be dragging on the ground. They can't be having any excoriation on it, because it's a transportation violation with CFIA, regardless of where they're going to go. So again, here we go, the barbecue market. So you're not going to see a lot of these. I mean, they show up once in a while. I have to say, the only time I did see a pile of scrotal hernias was an entire litter of potbelly pigs, the male side, obviously. So it is genetic. Scrotal hernias are inherited, much stronger inheritance than umbilical hernias themselves. But just kind of keep in mind, if you really have a surgical bent and you're brave and you think it's big enough or small enough to deal with as far as hernias, like, knock yourself out. But again, it's probably better to send them to the market. Rectal prolapses are, yeah, they're there. Their bums like to fall out. I think I talked about this last week or not. I also had things I do for expert witness cases. I did have a case on rectal prolapses and shipping violations. You can ship pigs with a fresh rectal prolapse, provided it's not too large, as in, this big. my hands went off the screen. Sorry about that. It's not too large, and it can't be bleeding. So they can be fresh and shiny, and you can put them on a bus and get them out, and it's okay. If they're necrotic or they've been going a while, which is probably when you're going to see some of them, excoriated, bleeding, you're better to try and effect a repair on site before you send these animals out. Causes of rectal prolapse, I'll bet you $1 million in smallholders. It's pigs that got chilled, and they'll pile on top of each other, kind of like a Jenga. And if they're big enough, the guy in the bottom has got an awful lot of weight on top of him, and just a simple abdominal pressure will push out that rectum, and away you go. As an aside, it's not that uncommon in humans either, which, didn't know that till I had a case. I had to read all this stuff up. So it can be just a mucosal eversion, or it can be the entire thickness of the rectum everting. Can also be caused by diarrhea. So especially more of a colitis type of issue. You have irritation there, and we would think of things like, hopefully not swine dysentery, which is a treponema, or brachyspira, but could be that, possibly salmonellas. So you want to be sort of mindful if there's evidence of diarrhea in the pen, that you want to kind of work that up as well, because it isn't just dealing with the prolapse, it's working your way back, peeling that onion and saying, what's going on? I got piled pigs in there, and I clearly see that there's insufficient bedding, or the bedding's wet and damp, and there's just no place for the pig to burrow and stay dry and warm. Address the primary issues that are going to prevent you from coming back and having to fix more bums that have fallen out. You can separate the affected pens from their pen mates as soon as the signs are seen. And depending on what articles you read, a couple of them that I was looking at not that long ago actually suggest that small rectal prolapses can be left for their pen mates to sort of chew off, which is a pig thing. I probably would prefer to see them repaired myself. And if it's certainly in a larger pig, like often it'll be a sow, and she's got a prolapse and she's due to farrow, or she's just farrowed. And if it's fresh, you can use the old uterine prolapse technique and put sugar or salt on it, get an osmotic effect, draw out the fluid, the edematous fluid, shrink the prolapse, pop it in, sedate her as well with zaparone or Stresnil, infiltrate around the anus, and do a little purse string suture. And again, if you're surgically inclined and it's a big enough pig, there's a satisfying rectal prolapse repair, and you will be a hero. Procedure 2, get a rectal tube, and it's smaller pigs, pop it in there. You use like an elastrator, or just wrap some suture material around. You can see the little indent there in I'm pointing my finger, I know you're all following that. There's a little indent there in the tube, and the necrotic outer tissue will fall off after a few days. The tube will pop out with it, and the pig be fixed. Again, you're a hero. Transportation, I alluded to that earlier on, and we talked about that in the first lecture as well. So just remember, if you got a rectal prolapse, umbilical hernia, things like that, these are compromised animals. You want to make sure, well, a hernia is, I would say their prolapse isn't, but it should go direct to local slaughter. Make sure that the animals are weight bearing, that they're not compromised, or they're 3-legged lame. That is a no-no. Any pigs showing signs of distress should not be loaded. And you can refer to, remember the codes of practice, and there's appendices at the back of the codes of practice, and they'll outline very nicely the conditions that will preclude an animal's ability to be transported. Things like a very sick animal, obviously you're not going to put on a truck. I double checked this, and I'm going to have to check this again, because I see I have here with sows that farrow within 48 hours for sure can't be shipped, but you probably shouldn't even ship them then. Or if they're likely to farrow during transport, 100 days or more. But I just looked something up, and I saw 6 weeks, and I got distracted and I didn't follow it through. I think the codes of practice say 6 weeks. Oh, there it is, right below there. 6 weeks away from farrowing. There you go. So ignore that second line. I should have removed that. It should be 6 weeks. So a recent surgery. So if you've done a heroic umbilical hernia repair and it's fabulous and they want to ship the pig, it has to be healed. You can't have any fresh incisions, stitches, whatever, even a castration. They should be healed. Stressed pigs, exhaustion, heat stress, weakness, labored breathing. And so that could be sort of hot days. I'm working in a case right now, and signs of hyperthermia in swine. If it's 41 degrees out and the humidex is 100, everybody's going to be stressed. Don't put that pig in a truck. Wait for a cooler day. And pigs will do exactly that. They'll be weak, trembling, labored breathing, panting, vocalizing, falling down, blotchy skin. You may think it's African swine fever, but if it's a 41-degree day with 100% humidity, it's probably just hyperthermia. There's that list I was referring to. Gosh, I'm really sounding organized tonight, aren't I? I've clearly been doing too much today. Should this pig be loaded? So refer to your codes practice. Just load them into your phone. They're really great to have there. You can't make a mistake with them. And this is also a difficult topic, especially with smallholders and pet pigs, which we'll talk about next week. But they get to know their pigs. I mean, it's like small dairy herds, and I worked on one years ago as a student, and 35 milking a string, and everybody you knew by name. And it was really hard for me, as that student, to see somebody have to go to the barn as a cull cow, because it was Dorothy the cow leaving the barn. It wasn't just sort of that Jersey that kicked me every time I went by her. And it's the same with smallholder pigs. It can be really difficult to convince them that that this pig probably should be euthanized. And if it's been around a long time, like maybe an old sow, and she's become compromised, it's a conversation that you need to have. And I recall a story being told to me of an elderly couple, and they had 2 old sows in their barn, and I believe both of them were so big and so old, they really were unable to rise on their back end. And whether they were arthritic or they had other issues, but they were really non-ambulatory, and they just sort of dragged their back ends around, but they were enormous just from eating and sleeping. And the veterinarian record had a difficult time to convince them, but he did, that it was better that they be euthanized, just because they were severely compromised, and then pigs that big, you're going to get into muscle necrosis and lesions on the skin on the downside and whatever. So quick algorithm, is the pig likely to recover or not? If it's not going to recover, can I transport it? Is it marketable? Should I keep treating and monitoring? And this always becomes, the problem. How long do I go? We've all seen, I think, miraculous recoveries, and certainly everybody's always hopeful, especially with backyard pigs, that it's probably going to make it. I'll just keep it a little longer. Well, it's looking better today. So sometimes people need assistance with making that decision as to whether we should euthanize them or continue going along. One of the best I guess points of reference for when is it time is was told to me by somebody who worked with a manager in a large commercial swine herd, and they had a hospital pen, and they had pigs in there, and they had a couple of these pigs. They weren't, the 300-kilo sow kind of thing, but who were not really able to walk well, and they kind of hobbled over 3-leggedly to the feeder, and they were eating, and so the question was put to the herd manager, well, why don't you euthanize them? And I thought this was a really good answer, because it's what I tell, and I'm sure we all do, tell people with small animals, why don't you euthanize it? And he said, well, I figure so long as it's getting up and it's coming to eat and it's drinking and it seems to be okay with its pen mates, then I think it's got a quality of life. And when it stops eating, then I guess I'm going to euthanize it. And I thought, I don't think I can argue with that. If his leg was that bad and hurting him that much, clearly he wouldn't be going for the feeder or the waterer. So I think the moral of the story is everybody has kind of a different endpoint, and they're not all the same. And so you can't always draw that line in the sand. I mean, I think it's easier with larger commercial farms because, you know, if we had a lot, you know, 2 or 3 of these hospital pens with these pigs that we're giving, you know, a quality of life to, we're also removing valuable space from other pigs, and so it becomes a bit of a trade-off in that sense. You know, and normally we wouldn't have 3 pens full of compromised pigs anyway. But anyway, for sake of an argument, you know, it's allowing for that producers to know their pigs that much better because they're smallholders, and respecting their thoughts. I mean, if you find at this point now the pig is truly compromised, then you have to talk to them, as in those 300 kilo sows. So they may euthanize, or you may be able to ship the pig, depending on what that condition is. And again, not being able to walk, it can't be transported. Extremely thin pigs, no, don't put them on the truck. Don't get that last 5 cents out of them. They should be euthanized. Arthritis, multiple joints, prolapsed uterus, we saw photos of that last week. Absolutely not. Rectal stenosis, so that can be a consequence actually of having a rectal prolapse and it was repaired, but if it was salmonella induced, you may wind up with rectal stricture, and then the pig is unable to poop really well, and then just its abdomen starts enlarging and enlarging, and they just, I call them football pigs. And you know, they sort of have this little teeny head and a little teeny bum, and then the rest is all this giant abdomen. So it's, you know, don't put that pig on the truck. There's no reason to do that. Hernias that are very large, touching the ground, you know, they're excoriated or bleeding at the bottom, you know, been dragging around, so forget that. Severe recent injury or suffering from a severe non-responsive disease, like, you know, severe pneumonia, something like that. We don't transport them. So I do give euthanasia courses periodically, actually with captive bolt guns, but I like this slide because we actually are fortunate when we work with pigs that we have actually a lot more options than, let's say, dairy cattle or beef cattle. You know, we have anesthetic overdose, which is acceptable across all the classes of swine. We can use blunt force trauma, not everybody's cup of tea, but in little piglets, it is acceptable under 9 kilos. Electrocution, I'll leave that for later, but or some other time, but it is conditionally used. Carbon dioxide, there are commercial carbon dioxide boxes that meter in warmed carbon dioxide gas for euthanasia of young piglets. We have non-penetrating captive bolts, penetrating captive bolts, and gunshot. So depending on the person's choices, you know, they may, I think mostly you'll probably see gunshot in the smallholder operations. Sometimes they have nothing, and that's where you'll need to step in and either sort of be the person that euthanizes the pigs that have issues, or teach them about the uses of something like a penetrating captive bolt. And I do believe that a lot of veterinarians now have been exposed to the penetrating captive bolt and its uses. I took a long time to come around to using it, I think because the thing goes bang. And I've been using them now for probably 10 years. No, more than that. Yeah, 10 years. And it's just slick. You know, and there's no risk of ricochet as there is with gunshot. So, but it depends on your choices. You may just say, nope, I'm going to use an anesthetic overdose, and that's all good. You know, and depending what the smallholder prefers as well. So we do have different choices, but do note it depends on the class of swine that we're euthanizing. So for the codes of practice, you have to have some kind of a plan for timely on-farm euthanasia. And so if they're just going to call the vet out to euthanize, it means you're on, you know, you're on call to put pigs down, and that's probably not going to happen. Like I said, many of them will be using gunshot as an appropriate technique. They're acceptable. Just note, please, if they're going to be using gunshot, you can use a 22. It's got enough muzzle energy to dispatch the pig. But do note that adult pigs, I've often heard from people, it's like, well, the 22 doesn't quite do it. And it's like, because it's just doesn't have the appropriate energy to getting to where I need to go. They have this monstrous skull with a big sinus that bullet has to travel through. And so you can use a 22 Magnum, which is a different style of rifle. You need a full metal jacket bullet to penetrate to get into the brain. And again, yeah, there's a whole course developed on this. This is sort of the nuts and bolts of euthanasia. If you're going to use a captive bolt, if you're comfortable with that, you know, you're going to make sure that you sedate the pig before using the captive bolt. It's so much easier. And even before you sedate the pig, I'm going to tell you, and when I teach this course, I tell everybody, you've got to plan how you're going to do this. I don't care if you're in a big barn. I don't care if you're outside. I don't care, because the one thing about euthanizing pigs with either gunshot or captive bolt is they do thrash. And it's surprising how much they'll kick, you know, maybe over 30 seconds to a minute to 2 minutes. They're just, it's just the way that they exit this world. So you want to make sure that wherever they're going to fall down after you've used either gunshot or captive bolt, they don't thrash obviously with anesthetic overdose, but whatever you're using as far as the concussive type weapons, that you make sure that there's nothing around that's going to fall over. I'm going to tell you a little story, because I love telling little stories. But I had to go to this large barn, and they had a huge boar in a pen, and I hadn't been to vet of record for very long. And they said, we only use 22s here, and we know it's not going to, you know, be useful for this boar. This boar had to be 350 kilos plus. It was a great big Yorkshire boar, really nice boar. So he had a bad leg, so he couldn't be transported. And so I appreciate that, you know, they had held on to him, but they really didn't know what to do with them. And I said, okay, well, I'm going to give you a captive bolt course. And and he was in a really large pen. It was really nice. So I said, okay, we're going to sedate him. And so we used the top dose of Stresno, and I probably doubled it, which it's fine. He's going to be gone anyway. So, I mean, I wanted to make sure that everybody was going to be safe, because you can't trust a boar. And so we came back after 20 minutes, and he was snoring on the ground. Well, that's great. Perfect. And so I looked to the back, and it was a large pen with a big, probably a 4-foot metal gate at the back. So opened it up, and I hopped in, and I got one of the guys. We put I don't think they had a snare. I think we used a rope around his snout, and we tied it to the gating on the side. And I showed them, which I'm going to show you in the next slide or two, where the ideal spot for applying the captive bolt. You know, I made sure that I was on the back side of the pig, along the spinal side, and not the legs, because remember, those things move when you're using concussive force. So you euthanize the boar, and yeah, he started kicking. So when he starts to kick, we cut the rope loose. If you got a snare, you unsnare the pig, you just let it go. This pig kicked so much that he kicked the 4-foot metal fence or gate off its hinges and sent it flying across the back part of the barn. Moral of the story is going to be 2 people doing this, and one's almost the spotter. If you're going to be in there euthanizing them, and usually it's straightforward, but you want to make sure you walk your brain through the procedure. You take care of yourself, you're taking care of the client, you make sure the animal's not going to wind up in some difficult area as it's spinning around or kicking, you know, that you've got another problem. And so they'll kick, and then after it stops, you apply a second shot for any animal that's greater than 120 kilograms. I recommend a second shot regardless. Those little charges for captive bolts aren't that expensive. Second shot pretty much guarantees that, yep, I used animal. And then you confirm death when before you leave the animal. So no corneal reflex. It's obviously not breathing. Now, as a veterinarian, you'll have your stethoscope. You can check for a heartbeat. It takes anywhere from 5 to 10 minutes for that heart to stop, but don't move the animal until you've confirmed death. So that's kind of captive bolt, and I probably have done it a little bit reverse here, but so these are captive bolt devices. I'm sure the one on the right here, that's a Blitz style captive bolt gun, a tube style. There's actually a couple manufacturers of these. This is the pistol style, this is a cash gun, this is a Jarvis, and this is a non-penetrating captive bolt that's used on small pigs. So we have a variety of these, and really, they're very simple to operate, they're simple to maintain, and there's really should be no fear attached to them. They're far simpler than guns in my world. And yes, I just recently started shooting a 22, so I finally, climbed that mountain. At any rate, so the non-penetrating captive bolt is for pigs under 9 kilograms, as I showed you in that chart. Work on compressed air, or they can work on gunpowder. And so it just concusses the brain of the piglet. And why is it non-penetrating? Because the brain is so close to the top of the skull that it's very easy to get a concussion and then render the pig permanently unconscious, and then it will succumb. So it's basically, they've done an X marks the spot. I'll show you where how I prefer to line up where it's supposed to go. There's another non-penetrating photograph there. So it's kind of like a mushroom tip on there. You've got to have the pig restrained, whether it's sort of in a sling type device. If they're really compromised, you can sedate them heavily, just have them on the ground, hold them behind the head to steady the head. And then again, 2 shots and away you go. This is, it's really hard to see in the left, but this is a non-penetrating captive bolt for the pistol style. And you can tell it's non-penetrating because it's got a big flat part inside of the head, which I'm pointing again, inside the head of here, this is flat. And again, will cause that concussion. Where do we shoot? What's my best description of where to go? Well, there we go. I should have a picture here of where we shoot. There we are. I'm going to go back and forth. Sorry, this is not well organized tonight. Just all pigs have eyebrows. And I goes, you guys never pay attention to this fact, but all pigs got eyebrows, whether they be brown, they be black, they be spotted, they be a Hereford. And you just draw a line across the top of the eyebrows and just go a little bit above. That's where we put the captive bolt. That's also where we put the gunshot. That's where also people make all the mistakes. So you go, draw your line across the eyebrows, put the captive bolt firmly against the head, 90 degrees, and use the proper charge and bolt length, which is kind of getting, if I have to give you all that tonight, I'm going to run out of time. But you can certainly get a hold of me if you're interested in more information, and we can go from there. There's certainly information that's supplied with the captive bolts, which I find it's a start, but it's better to expand on your knowledge. So why the proper charge? You use the largest charge possible for that size of pig, and the bolt lengths are usually pretty standard. I don't worry about that as much. But the brain in a pig is a small target, and it lies underneath that great big sinus. So again, there's a couple of captive bolts. How do they work? So this is, whether it's the tube type, which has a different rubber dampers, but you'll see this is the bolt, and then there's rubber dampers, and then there's the head right there that we place against the head of the animal. And what happens is you fire the charge, it pushes this part of the rod downwards, the bolts compress, this goes into the brain of the pig, I think 1 3/4, 2 inches in, so that should do the job. And then the bolt, the rubber dampers expand and draw the bolt back. So that's why it's captive. It's not staying in the pig's head. It's perfectly safe, and it works really, really well. There's the placement again on the pig. And again, sedate the pig prior to using the gun, as I told you, and make sure the pig is dead. And then one thing you probably should think about ahead of time too is, where is this pig going to go? Is it going to go to dead stock? Is it going to be buried? Is it going to be composted? Incineration is not practical for most farms, and I don't think we're allowed to do it right now. And pet pigs, as in next week, they may, elect for cremation or a pet cemetery or something like that. So you also need to find out sort of what are the possibilities. Certainly, maybe a lot of people want to bury them if they've got an acreage. But you want to check with the Ministry of the Environment as to the requirements for burying on the farm. How far down do we have to go? You certainly don't want scavengers sort of digging up that pig and carting away parts of it. Not really good. Burial pits, I mean, there's just some examples. This is from BC. You have to be aware, obviously, that if there's a high water table, it's probably not a good idea to bury that pig. This is again, more for larger producers, because they're looking at 2,500 kilos of mortalities per pit. Don't think we're going to be doing that with our smallholders. Compost, some people will use compost. It works pretty well too. Again, it depends on the size of the herd. You won't have enough animals to compost in most smallholders. They're just, fortunately, there aren't enough deaths. So you have to think about that as well. So we're going to soar into biosecurity. I'm going to apologize again tonight. You've heard about ASF and now all these other things, and so you've probably got a lot to think about. But biosecurity is hugely important. We certainly, we talked about it a little bit earlier on, but not only for foreign animal diseases, but really for regular diseases is where it's really important to keep these pigs healthy. And again, if you as a veterinarian are doing more pig work, you're important as well in keeping the biosecurity of that herd yourself. Changing your coveralls and, having plastic boots that you're wearing, you're not wearing your rubber boots you kind of like drag from farm to farm and bin wherever, as I used to do as a much younger vet. A lot of pigs herds, not so much smallholders maybe, but I shouldn't be saying that. Some of them are pretty aware of biosecurity, and they'll have a pig-free downtime, which I have with a lot of my high health herds. Foreigners, visitors coming from foreign countries, when there were issues with was it epidemic diarrhea in Europe before it got here, there were people who were having relatives visit their farms on the commercial herds that I work with, and they would, just to be safe, they would put them in hotels, for 3 or 4 days, and they would take their shoes and burn them and get them new pairs of shoes. Like it was sort of extreme, what some people were going through to keep out, the chance of having these coronaviruses, which of course had epidemic diarrheas and got here eventually. But they were being super careful to not have it come into their herds here. Obviously, reminding our smallholders not to feed table scraps that have come into contact with meat products. And, so it's working together to keep these pigs as healthy as possible. Having signage out there, sometimes this seems to me like, a trap for flies almost, because some people, as soon as you put up a sign saying don't enter, they want to come in and see why you shouldn't be entering, which is, yeah, I don't understand this, but it's happened too many times in my world. Lock the doors. If it's a big enough operation, locking doors at night is probably a really good idea. It's really strange where people want to go at 3 o'clock in the morning. People shouldn't be allowed into your pig barn again within 24 hours minimum, and people should go in with them. You shouldn't just open this place up and let anybody come in. Again, have changes of footwear and coveralls if it's appropriate, if it's a big enough operation. I mean, if they've got 3 pigs, it's not probably less sensible, but and again, as I said, determine where your visitors have been prior to coming in. Limit unnecessary visitors. I mean, these are just all suggestions. I don't think smallholders are going to keep a logbook, but maybe they will. Wash your vehicle prior to arriving. I doubt that's going to happen, because I don't even get asked to do that myself. I just sort of take that on myself periodically with my vehicle, like once a week. Zoning of farm areas, and Again, for smallholders, maybe not, but you need to understand the biosecurity. So, you know, there's basically 3 areas. So there's the controlled access zone, which is really the entry to the farmyard, and that's where your signage goes up to keep people out of the farm, unless they're there as service people or feed people or whatever. And again, depends on the size of the smallholder operation. But having, at least, even if it's a chain with no entry, it tends to, it's a visual barrier. It keeps people out, and it's not a bad idea. Specific boots are worn transitioning from, this area over to the barn, or you have boot covers you can wear. Then you've got the transition area, and that's where you come into the barn and you change your barn specific boots and clothing. And then this area separates the outside world from the pigs, if the pigs are kept inside. And then you have a restricted access zone where the pigs are, and the rest of the world is sort of away from them. So again, this can be sort of a bit extreme for a lot of smallholders, but there are some fairly large smallholders, 20, 40, 50, 60, probably even 100 sows could be considered realistically a smallholder in today's terms. We talked about Danish entry, and that's always a really good idea. It just keeps dirty stuff on one side and the clean stuff used on the barn on the other side. Washing hands does wonderful things. This is just to show you, this is a high health gilt breeding operation from one of the genetic companies. And I used to drive up, and so I would park well back of this building here. These are the feed tanks. Walk into this building. This is a Danish entry, very nice. So you sit down, you take your shoes off, swing your legs over, you put on a pair of boots on this side. Then you walk to the barn. Then you dunk your boots before you go into the barn, and then you leave them at the entranceway, and then you shower to go into the barn. And so this is not uncommon for very high health breeding operations. A lot of the barns I go to will simply have a shower through. A lot of the smallholders, if you get to do a Danish entry, it's perfect. It's just a really good reminder to keep people aware of biosecurity. We want to keep these pigs clean. Again, we talked about quarantine in the first lecture. If they're big enough and they're buying pigs, maybe they're buying Mangalitsa's or Kunikunis from the States, and if they are coming up from the US, they will be quarantined for a month before they can enter the herd. And that's a CFIA requirement. If they're coming from another province, or another part of the province, probably should keep them apart from pigs for a month. Why? Just because if they're going to get sick with something, they're going to be separate from the rest of the herd, and we can deal with it so that, hopefully they don't pass anything along till they've recovered, so to speak. And if we're working in these barns, you're going to do the quarantine or the sick pigs last. You're going to do all your regular pigs first. So you have to think about sort of the order of going through. A lot of smallholders, it's just everybody's together, one big happy family in the barn. So it may not always be that easy as what I'm laying out here, but it's something to think about. Again, new animals, don't get them from auction farms. If they can come from single source with known health status. I had my delightful once a year preg check a cow visit. This is the only time I ever preg check a cow. My neighbor has one Guernsey and a bunch of actually Wagyus that they got from the States. But I went to the barn, and I was simply delighted to see a pair of really nice market hogs there. And I said, "Oh my gosh, you got pigs?" And she says, "Yes, they're from one of your clients. I bought them." And so when she'd asked me about getting these pigs, I said, "Yes, better to go direct." And they know that these people, they all are in the same community, and got a lovely pair of pigs, known health status, and they just look fantastic. And I was so happy. And the cow was pregnant, so we had a good day. Again, I think I'm going through quarantine a bit too much here. Fencing we talked about as well. Keep predators out, keep pigs in. Should be a dual fence if they are allowed access to the outside. And so one is to keep the pigs in, and one is perimeter fencing. And again, as far as, under biosecurity, it is important to know your source of feed and keep it, pest-free, rodents birds, that sort of thing, because birds will shed organisms in their feces and can contaminate feed, and pigs as well. No meat, we went through that before. And really, the codes of practice, they say you really should be cleaning your pens once a year. You may not be able to power wash, but if you can scrape them all down, use a little lime to disinfect and then put your bedding on top, it's a really good idea. And again, rotating pastures, we talked about that too. These little fellows, you want to make sure that we have rodent control, because wherever there's animal feed, there certainly are rats and mice. And make sure that you've got bait stations, or the producer has bait stations that they're using. Why? Because bait stations should be outside of the pig pens and in areas that pigs can't get to. And because if pig gets a hold of it, it will crunch that bait station up like there's no tomorrow, and then you've got a pig that's eaten bait. And just as an FYI, I had dealt with indirectly some finishing pigs that had gotten into rat bait, and I was quite curious as to how this happened. And it's simple. Somebody they were doing their home baiting. They put the tub of rat bait up on the top of the cement wall of the pen, and pigs are really clever. So one pig jumped on the other pig and grabbed the bucket and knocked it over, and everybody had a heyday. And just so you know, the withdrawal time for warfarin, if it doesn't kill the pigs, is 6 months. And so there were some pigs that got euthanized because they would just be far too expensive to keep for 6 months, and also far too large. So kind of a bit of a sad story, but that's what pigs will do. So make sure those bait stations are well away from the pigs. Again, we talked about, getting rid of the dead stock. It's just appropriate, especially to avoid scavengers. And even with trucks, again, it's hard with smallholders, because they're either going to take the pigs themselves, or they've got a small trucking company, or the trucking company will send a small truck to pick up pigs from them. So the slaughter plant is actually a high risk area for disease spread, because there's all sources of pigs going there and being unloaded, and it's actually the contact with the loading docks where the problem happens. So a lot of my large commercial herds are requesting that the truckers do this. I mean, the trucking companies will have cleaned and washed and disinfected trucks. We started doing this a number of years ago, and like one of the best things that ever happened. So smallholders sort of more difficult, because they don't have that many pigs. So they're using somebody commercial. It would be lovely if they were able to clean that truck before coming out. And then just going through, and I really apologize, I'm sort of throwing everything at you in this slide deck, but you do have the notes for it too. So the vaccines with the stars are kind of common: circovirus and mycoplasma vaccines for 3 to 6 weeks of age. PRRS, perhaps, if you've got an exposed herd or there's issues. Erysipelas, maybe if you've seen problems with it. Influenza, maybe if you've seen problems with it. Again, it's probably more herd specific, but the Circo Myco are the common vaccines that are used. For sows, leptoparvo erysipelas for sure, especially outdoor pigs. Erysipelas is not uncommonly seen. And then prior to farrowing, E. coli and rotavirus vaccines. And as a reminder, and I think we went over this in the first lecture, 2 doses of vaccine 21 days apart for the gilts. So you get that booster effect and the antibody rise, and then after that, it's just 1 booster is needed for sows prior to breeding or farrowing, depending on which virus or vaccine we're talking about. Circovirus, some people recommend vaccinating sows prior to farrowing. Again, I've got a star beside it, but I think it just depends. Again, looking at the needle size, we talked about that earlier. And then parasite management, we treat them like twice a year, sort of typically every 6 months. Ivermectins are easy because they can be injected. Fenbendazole, parentels can be used. We often just deworm the sows. I have 2 to 3 weeks here. Some people deworm them a week before farrowing when they're in the farrowing crate, maybe if they have a farrowing crate. And then they can just, easier to either inject or top dress their feed with a dewormer, depending on which ones you're using. Doing fecal egg counts is not a bad idea. You can do targeted deworming that way. And again, regular pen cleaning, although I will tell you that the ascarid egg, it goes forever. I mean, up to 15 years and they're still hatching. So just scraping a pen down isn't going to be a guarantee you're going to be getting rid of ascarids. It's basically regular deworming for those bad boys. Grower finisher, again, depending on what their local butcher's finding, the liver lesions. I usually do recommend deworming, but it depends. So again, you might want to look at fecal egg counts. That's a really useful thing to do. And then you can do targeted deworming for these guys. And here we are. I got 4 minutes to go and I'm finished. I do apologize for kind of a jumble of information today, but I didn't want to leave anything out, and I think I put too much in. So I'll stop there and take any questions if you have them.
Well, Dr. Sue, I think I can speak for everybody. I'll be confident on this one. Like, you don't need to apologize. That was, as usual, an excellent presentation. Really interesting. Definitely quite a range of material, but that's okay. It was really interesting. And in fact, you do have a few questions in the chat. You have one about, we see scrotal hernias since the producers started using Improvest. I may be mispronouncing that, but they mean chemical slash immune castration, and causing more. Does that cause more scrotal hernias? Don't know how often that'll be used with smallholders, but.
No, yeah, no, I would say not, because Improvest is used actually in, I can't, in the finishing pigs. So it's actually in the large pigs is where you use them. So we don't.
I was struggling with the math on that one too. Yeah.
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 No, so it would be, it's a good question. And I think there's more Improvest used out west than there is in Ontario. And I may be a bad person to ask about that. I don't have anybody using it in my practice, but it's 2 injections. So it's I have to get this right, GnRH inhibitor. And so they get 1 injection and then the second repeat, I think it's 3 weeks or a month later. And then it basically, you can keep the boar intact. They'll grow faster. They'll be leaner than a castrated pig. So that's the purpose of doing it. Myself, I think hopping into a pen full of pretty randy boars would be like, ooh, yeah, I need my, full metal jacket on, or, some kind of chainmail or something to inject them. But it is effective. But I think, is it smallholders? We can castrate them. That's probably just as easy.
Okay, well, thank you. I hope that answered the question for Nasib. And great segue, by the way, because the next question is, what suture material and size do you recommend for adult boar castrations?
So you're certainly, you're going to tie off the vasculature, but I would say to you, I would not suture up the skin incision. It will close fairly rapidly, and you need to leave it open to drain. If you happen to have a bigger incision because it's your first crack at it, so to speak, you might want to just, you want to use something that's going to be an absorbable suture. I know we're not supposed to on skin, but hey, I mean, this is the real world. Are you going to chase that boar around and try and take him out? Think about it. I think it's going to be easier just to use absorbable and go, yeah, it'll fall out eventually. Do 2 or 3 sutures at the top end of your incision, leave the lower end open again for drainage purposes.
And any recommendations on size-ish? If you're using gut or something, what size would you?
Yeah, I've always been an aught person. Anything aught works for me. It's not too big, it's not too small. It's robust enough to get the job done. So I don't know. You're talking to somebody that doesn't do a lot of surgery anymore, sadly.
Okay, yeah, no worries. Aught is the sweet spot. Okay, we got it.
Good line.
That I'm on a roll here. But anyway, another question about castrations. I recall there used to be a method of boar castration up to 400 pounds. where you would inject the testicle with sodium pentabarb bracket euthanasia solution. The pig would become sedated as it was absorbed. You castrate and remove the source of anesthesia, and he'd wake up. Is this still a thing?
No,
Okay.
no. I think where you're going to get into trouble is someone's going to have heart failure over pentobarbital and potential meat residues. And
I did, in fact, just to be thorough, while you were talking, I looked it up, and not surprisingly, couldn't find a withdrawal for pentabarb. So yeah.
yeah, no. I think, yeah, I mean, years ago, probably we used that. I didn't. I don't remember doing that particular one. But that would be the concern, because the testicle is so vascularized, you're going to have some leakage of this into the musculature. And of course, there's all this hullabaloo about, if you use pentobarbital, and that's probably a good point. To euthanize a pig, you're not supposed to put that animal into the rendering for pet food production, because there's been dogs that have been heavily sedated by getting a little chunk of sedated cow or euthanized cow or pig in the States.
Okay, so no, that's a
No.
simple one. Yeah,
Yeah.
okay. Another question here. After captive bolt, so I guess now we're obviously on to euthanasia. Have you followed up with pithing?
No.
Okay.
You don't have to. I get grossed out by pithing. I'm sorry. No, it's actually so they have suggested pithing in cattle. I find the 2 shots perfectly fine. I've done a lot of captive bolts in pigs. Remembering and thank you for the question, because remembering, because I forgot to add this in my talk, it's not the bolt that does the damage. That's kind of the coup de grace. The major damage is done by the concussive force of the captive bolt. That's why having the appropriate charge, you get a massive concussion on the head of that pig, which actually tears the brain off of some of its, away from some of its connective meninges and things, and you have disruption of vasculature, you have bleeding. I mean, it's sort of a very fast event, but it's the concussion that causes the irreversible damage. The bolt is a bonus. It doesn't necessarily have to get into the brain. And so this is kind of an admonishment from a mom who's had too many kids playing terrible sports. That's why concussions in humans are so serious. It's not that you'd hit the brain, like it wasn't sort of the direct hit to the brain. It's the concussive force that's causing some of the damage and tissue damage that way. You know what I mean?
I can picture it, actually. So yeah, I think you painted
Yeah.
that out pretty well, actually. Thank you.
Yeah, there's actually somebody, maybe Jennifer Woods. I think Jennifer Woods, if you look up Jennifer Woods and Cash Gun, she actually was instrumental. She has livestock services out west. Instrumental in having one of the captive bolts modified for euthanasia, and did this great work. And they looked at the brain damage done after the uses of these, the sort of before and after captive bolt gun. So if you really are sort of morbidly interested in what happens, you can look up her name, and I think it was back in 2011. Find her work on captive bolt guns and sort of see what they do. They are very effective. Used appropriately, they're my go-to.
Okay, that's clear. Thank you. That's all I see in the chat. If I may, I have one myself on CanSpot, and so I'll just throw it out, and if it's something we need to, but it's a really basic question. I guess if we need to get hold of Krista, we could. But so I was picturing, I'm out on a call, not super familiar with pig postmortems, but I think I've got something that's a septicemia. But I guess, I heard this great presentation. Perhaps one should consider asking for CanSpot testing when I submit the samples. What do I tell the owner? Like when until we get a suspicious or something back from one of the Kazan labs, is everyone cool, calm, and collected? Or because I have enough uncertainty because I'm a rookie, do I tell them anything then as far as animal movements? How does that, like, at what point do we get antsy, I guess, is the heart of my question.
That's a really good question, and that's not a rookie question. That would be still a me question.
Okay.
And I think it would have to do with the history. Again, go all the way back to the history. Do we know where these pigs have been, like where they've come from? Or they've always been established there, and it's kind of a little closed herd. Nobody's coming in. Nobody's left the country. Nobody's come back in with anything. Had no visitors. Like if it's sort of like got nothing, then I wouldn't get too lit, right?
Okay.
If I have a kind of a history of, well, yeah, you know, the grandparents went over to see the cousins in the old country, and you kind of follow it through, and, you know, did they kind of have anything in their soup? Well, you know, I mean, I remember years ago, my parents' friend, you know, they brought back this speck, which is this like sort of smoked, uncured, or yeah, bacon kind of thingy, whatever, and everybody loved it. And I think about what we used to sneak back years ago, and it's like, ooh. So it, you know, if it's more of a story along that line, that there's a possibility of introduction, you would take your sample, but you know, you could, I mean, why not call CFIA and just say, hey, you know, I'm not sure, and have a discussion with them. Call your district veterinary office.
Okay, so
Nothing wrong with
context
that.
sensitive, basically. It kind of depends on what the details are, and
It sure does. Yeah.
Yeah.
Yeah, for sure. For sure.
Great. Thank you very much. I think that's all I see in the chat. I guess, does anyone have any other calls? Or Doris, is there anything you wanted to add? Feels like we're winding down. Okay. Well, Dr. Sue, again, thanks from all of us. Thank you so much. Another wonderful presentation. We all really, really appreciate it.
Well, thank you all for hanging in there.
Well,
It was a
again,
lot tonight.
yeah, it was great. So again, thanks to everybody who joined the call. Thanks for joining us. Once again, a recorded version of this will be made available as soon as we can, and we'll email you with the links when that's ready. And so please join us next Tuesday, same time, same Zoom link, for the grand finale of our webinar series. No pressure,
The
Sue.
potbelly pig, yes.
Yeah. Okay. Great. Thank you very much, all of you. And again, thanks so much, Sue. Another great night.
Thank you. Thank you. Okay.
Bye,
Night.
everyone.